Have you ever been in the doctor's office and felt like they were paying more attention to their computer screen than to you? Yeah, you're not the only one. The whole idea behind digital records was to make healthcare better, but for a lot of doctors, it's turned into this paperwork plague, leading to a massive crisis we call physician burnout. But what if AI could fix all that? There's this new wave of tech, Ambient AI Scribes, that promises to be the cure by just listening in and writing all the notes automatically. So today we're going to dive deep into the first ever gold standard scientific study that really puts these AI tools to the test. Let's find out if this is really the future of medicine. To really get why this is such a big deal, just look at this number from the study. It's wild. For every single hour a doctor spends actually taking care of patients, they're spending up to 2 more hours just on paperwork. Think about that. That's not just some small annoyance, it's a massive, colossal drain on their time and their energy. And it's really the root of the entire problem we're talking about today.
And all that paperwork, that mountain of documentation, it leads directly to this, physician burnout. Now, this isn't just, feeling tired after a long shift. We're talking about a deep, profound state of exhaustion, emotionally, physically, mentally, that can completely change how a doctor feels about their job, their patients, and even their own life. It's absolutely crucial to keep this definition in mind to understand just how high the stakes are here. So just how serious is this? Well, the study is crystal clear. We are way past this being just an inconvenience. The scientists who wrote the paper call it a crisis, a full-blown paperwork plague that has real, tangible, and frankly dangerous consequences for literally the entire healthcare system. And here are those consequences, laid out plain and simple. When doctors burn out, it gets harder for us to even get an appointment. The risk of medical errors, patient safety events, actually doubles. It costs the system billions upon billions of dollars in things like doctor turnover. And of course, it puts the health and well-being of the physicians themselves in jeopardy. This is a problem that, one way or another, touches every single one of us.
Okay, so the problem is huge and clearly defined. What's the potential solution? Well, let's talk about these ambient AI scribes. These are tools that listen to a doctor-patient conversation and, like magic, write the clinical note automatically. But you know how it is. With dozens of companies making huge claims, scientists knew they needed real solid proof. And that's exactly what this study is, the first ever randomized clinical trial of its kind, the gold standard.
And for this trial, they put 2 of the heavy hitters in the ring. On one side, you've got Microsoft DAX, and on the other, a major competitor called Nabla. The whole point was to see if either of these tools could actually live up to the marketing hype and make a real, measurable difference for doctors on the front lines. So, how did they pull this off? They used the most rigorous scientific method there is, a randomized controlled trial. Here's how it worked. They got 238 doctors and randomly split them into 3 groups. One group got to use DAX, another group got Nabla, and a third group, the control group, got no AI at all. They did this for 2 months, and then they measured everything. This kind of setup is so important because it makes sure the results you get are the real deal, not just a coincidence. And that, of course, brings us to the moment of truth. After all this careful scientific work, did these fancy AI scribes actually deliver? Did they save doctors time? Did they help with burnout? Let's get into the results.
All right, let's look at the data. The very first, and maybe the biggest, question the researchers wanted to answer was all about efficiency. I mean, that's the promise of AI, right? Can it actually give doctors back their most precious resource, time?
And this is where things get really, really interesting. A clear difference popped up. On average, the doctors who used Nabla spent almost 10%, 9.5% less time writing their notes. And that was what we call statistically significant, meaning it's highly unlikely it was just a random fluke. But for the doctors using Microsoft DAX, the time savings were only about 1.7%, which wasn't enough to be statistically significant. Now, the study doesn't say why, but it makes you wonder, right? Is it better AI, a cleaner user interface? We don't know for sure, but when you look at the stopwatch, Nabla came out as the clear winner here.
But hey, saving a few minutes is only one part of the equation. The real goal here is to fight burnout. So the researchers also looked beyond the clock. They wanted to know how these tools affected doctors' stress, their feelings of exhaustion, and their general well-being.
Okay, this is the really fascinating part. Even though only one of the tools saved a significant amount of time, doctors who used either AI scribe said they felt better. They had modest improvements in their overall burnout scores, but here's the kicker. They had significant drops in how overloaded their brains felt and in their feelings of work exhaustion. So any AI was better than no AI when it came to well-being.
Of course, none of this really matters if the AI is making big, dangerous mistakes. And the study found that neither tool was perfect. Doctors reported that occasionally they'd find clinically significant errors, like leaving something important out or misquoting a patient. This was true for both scribes. And it points to a super important takeaway. These tools are assistants, they are not replacements. The doctor still has to be vigilant and check the work.
But here's a key finding that you can't really measure with numbers, and it comes straight from the doctors themselves. They overwhelmingly agree that the AI scribe allowed them to engage more with their patients. Think about it. By freeing them from constantly typing, the tech let them make more eye contact, listen more actively, and just build a better human connection. That is a powerful benefit for everyone in the room.
So, let's put all the pieces together here. The time savings, the wellness benefits, the accuracy concerns. What's the final verdict? What does this all actually mean for the future of medicine?
One of the coolest findings was something scientists call a dose-response effect. It's just like with medicine. The more you use it, the stronger the effect. Doctors who used the AI scribe in a higher percentage of their visits saw bigger time savings and even bigger improvements in their well-being. So it seems like really committing to the tool is the key to unlocking its full potential. And for the hospital executives, the people who manage the budgets, there is a very powerful business case to be made here. The study's authors actually did the math. They calculated that even the modest 7% reduction in burnout they saw could save a big hospital system about $2.5 million a year. A year! Mostly from not having to constantly replace doctors who quit. This tech isn't just a feel-good thing. It's about financial stability. So what's the bottom line from the researchers who actually ran the study? Well, this quote from their conclusion just says it all perfectly. The evidence supports cautious optimism. AI scribes show real, genuine promise for making doctors' lives better. But they're not a magic bullet. We should be excited, but we also need to be careful. Which leaves us with this one last thought to chew on. This landmark study shows us that AI scribes can be a really powerful treatment for the symptoms of burnout. But is it the final cure? Or is it just the first page in a brand new chapter of medicine? A chapter where technology finally starts working for doctors instead of the other way around?